You're watching Let's Chat.
Well, March is Endometriosis Awareness Month, and it's so good to have with me in the studio an expert, Dr. Mitch Dizon with Erlanger. So good to see you, Dr. Dizon. Thanks for coming on.
Yeah, thanks for having me.
So tell me about endometriosis. Why do we need to be aware of this?
Yeah, so endometriosis is actually a very common gynecologic condition in reproductive age women. So endometriosis is a condition where the glands that are normally inside the uterus can grow outside of the uterus. So it can grow on a woman's ovaries or fallopian tubes or even bowel or bladder.
So if it's pretty common, why can it be dangerous, and why do women need to be aware of it? Maybe what are the symptoms?
Yeah, so some of the most common symptoms of endometriosis include pain.
Okay.
And this pain can occur usually during a woman's menstrual cycle, but it can occur outside of the cycle also. It can also occur when a woman is having intercourse or bowel movements or urination. Long-term effects can include chronic pain, which, that pain can be really debilitating to a woman, severely affecting their quality of life, taking them out of work, or even, helping to take care of their families. It can also lead to issues with fertility. So some women can't get pregnant because of endometriosis.
So what might clue a woman into that she has that and she needs to get checked out?
Yeah, so like I said, pain is the most common symptom. So if they have pain during their periods that may not be relieved with typical medications, then they should talk to their OBGYN or their primary care doctor about getting evaluated.
Is there an age group that might be more susceptible to endometriosis?
Yeah, it can. It's usually in women who are in their 30s or 40s.
Okay.
But it can affect adolescents all the way up to a woman right before menopause.
Now, you said long-term complications like infertility. What else could women experience if they don't get it treated?
Infertility, chronic pain, sometimes scarring in the abdomen and pelvis that can cause issues also with bowel movements and urination.
What about managing this? Is there anything to do to prevent it? Or if you are diagnosed with it, how do you live with this?
Yeah, so early detection is the best thing for it. So, and then being able to manage it sometimes with anti-inflammatory medication or hormones. One of the things that I specialize in is the surgical treatment of endometriosis. So I can actually go in through small incisions. It's called minimally invasive surgery, and actually remove the endometriosis.
So let's say a woman comes into your office and she has it. Can you talk me through sort of the conversation to maybe lessen her fear of a life sentence with a disease like this?
Yeah, so I mean, again, the great thing is to see somebody about it. And then we have so many treatment options these days. The medical field has come a long way for the treatment of endometriosis, that anywhere from medication to surgery, we have new advances in surgical techniques to allow us to see more endometriosis and remove it and then prevent it from coming back.
Is there a genetic component to this? Like, is it passed down from mothers to their daughters?
Absolutely. That's the family history of endometriosis is actually one of the biggest risk factors for getting it.
Right, and as far as prevention goes, is it a diet thing or exercise? Or are you seeing certain groups have it more prevalently than others?
Family history is the main thing, but diet and exercise can certainly help.
Okay.
Help to lessen the symptoms.
So how can we make an appointment with you or anyone else? What would we look up?
Yeah, you can look me up on Google. That's usually the easiest thing, or Erlanger's website. But my office phone number is 778-6447.
Okay. Would you say this is a rewarding piece of what you do to comfort a woman that might be afraid? I'm a highly anxious person, and seeing a gynecologist about something popping up, I would get scared.
Yeah, absolutely. I mean, endometriosis affects 1 in 10 women in the United States.
Right.
But being able to treat this is extremely gratifying.
It is. Are you seeing an increase in this?
I am seeing a lot more now. Endometriosis is a big part of my practice.
Wow.
And so I see a lot of women.
Why do you think there might be more?
That's a really good question. I think one thing that we are doing better at is actually raising awareness for endometriosis.
And do you find women are told a lot, you're crazy, you're imagining this, you're just having period cramps, go home and have a glass of wine?
Unfortunately, I do. and that is definitely not their approach.
Right.
A woman needs to listen to their body, and if something just seems off, get answers. Go see somebody who will do that thorough workup to see if you have this condition.
And you would say you're already a good listener, because I've been asking you stuff before we even started the show. So people need to give Dr. March Dizon a call to find out if the pain they're dealing with could be this, or hopefully interrupt anything that could get started and turn into something pretty bad. So Endometriosis Awareness Month is March. Head on over to erlanger.org/women's services, or give them a call, area code 423-778-6447. They're also on Facebook. Thank you again so much for coming on, Doctor, and sharing the good work you do.
Absolutely. Thanks for having me.